thanks to all of you for coming and helping us this afternoon address this important topic. Before we do anything else, I'd really like to go through introductions. Let's start on my left here. Ruth, with you, could you, then we'll just go around. Could you please introduce yourself?
Certainly. My name is Ruth Clampert. I'm 74 years old. I was born in Vienna, Austria, at the time that Hitler was present, and I was one of the fortunate Holocaust survivors to be able to escape in 1940. And I think that most of my life after that, there was some underlying depression going on. And when I was in my 40s, or maybe late 30s, I had a miscarriage. And at that time, I had a complete breakdown, and I realized that life was just not doable anymore. And I had to seek help for this major depression, which actually presented itself first with anxiety, chronic anxiety, panic attacks that then led to agoraphobia, which disabled me for about 13 years, not being able to drive a car, not being able to walk down the street. It was very, very debilitating in so many ways, and certainly did a lot to fracture my fragile ego anyway at that time. So that's where my main challenge with depression began. And it was a long ensuing battle, but here I am today.
Thank you. Bill?
I'm a person that's been diagnosed with a major depression disorder for the past 7 years. I believe it's because of the behavioral health therapy that I've received that I'm able to be with you here today. My name is Bill Howe. I'm 62 years old. I live in Bath, Michigan, and I'm married with 2 children and 3 grandchildren. My depression started to slowly creep into my life as I held a highly visible and successful position as a government relations manager with a major international corporation. Initially, my depression was diagnosed by my family physician. However, looking back, the treatment didn't keep up with my advancing symptoms. I believe now that the intervention of a psychiatrist and the proper mix of medications truly made the big difference for me. As I mentioned, my symptoms began slowly. I found myself in a situation where the symptoms were almost silent, unnoticeable, and gradual, and changes in my behavior and thought processes. Then I did notice an increased irritability as well as impatience, coupled with a feeling of loss of control. And probably the most difficult symptom to explain, and maybe for people to understand, is the feeling of a loss of anything that's pleasurable, until it reaches a level where you experience the loss of all happiness. And no matter how hard you try to find it, you cannot. At the time, about a year later after my brother passed, I was diagnosed with prostate cancer, aggressive prostate cancer, I guess you'd term it, that was spread outside the prostate. And I went through the usual treatments, from surgery to chemotherapy to radiation therapy and hormone therapy, and then the roof caved in on me. I'm much better today and continue to improve. However, there are times that I still struggle. My cancer is controllable, and I'm very thankful for that. And when it comes to depression and doing a self-analysis, I've come to the conclusion that if you find yourself asking the question, you probably intuitively know the answer, and you should seek a medical opinion. I think the sobering fact is that we've learned that depression does not discriminate. It can happen to anyone, at any age, successful, not successful, rich or poor. No one's immune. However, the good news, I feel, is that the stigma associated with depression and other behavioral health disorders has started to slowly evaporate. And because people are being educated and learning more about the facts surrounding the illnesses.
Mm-hmm. Thank you, Bill. You've already included a number of the lessons that we're trying to give to our audience today. Kay, you gave us a great introduction at the beginning of this show. You want to do a brief recap of your introduction for yourself?
Yes, I'm Kay Jamison, and I've had bipolar illness since I was 17 or 18 years old. A very severe form of it, but also a very treatable form. And I think that, along the way you learn a lot of things, and one is get a right diagnosis, get the correct diagnosis early, get the right treatment, stay on the right treatment, and learn about it. Continue to learn, badger your doctor, and then badger some more, and then ask more questions. And keep your family well informed, your friends well informed, and above all, that this is treatable. It's a potentially fatal disease, and I think our colleagues don't often emphasize that enough, that a lot of people die from suicide, from depression, but it's also very treatable. So I always say to college students, this is a bad disease to get, but it's a great time to get it. We have a lot of really good science going on, a lot of good doctors, some doctors that aren't so good, so it's important to discriminate.
Thank you. Caitlin?
My name's Caitlin Davies. I'm 19 years old. From Ann Arbor, Michigan, where the university is, and I was first diagnosed with depression about 3 years ago, but I first began having symptoms about 5-6 years ago. My journey began summer going into high school when I noticed a change in how I was feeling, how I was acting. It was almost if I had lost myself. And my family, my mother and I went to go see someone, and they shrugged it off as being nervous going into high school. And I wasn't at all. But after that, we kind of just didn't really pay attention much to it until my junior year of high school, when I had a complete breakdown at school. And I called my mother crying, and we finally were like, okay, we really need to, advocate for you. We really need to see if something's wrong. And that's when I was finally properly diagnosed. And we went through a lot of doctors at first. I never found one, like Kay said, I never found one that I thought was really interested in what, for me, and interested in my case and what I was doing, and just treating me as another patient, but as a single patient for them and as myself. And after much persistence, we finally found a doctor who fit with me, and we began trying many different medications. I was on dozens and dozens of medications. I would get better to a point, but never over that hill to where I was really getting better. And last summer is when my doctor suggested ECT. And
that's electroconvulsive therapy.
Right,
yeah.
and it's not used very often, but I had gotten to that point where I decided, maybe this is what will work for me, this will be best for me. And it was an extremely hard summer, mostly I feel for my family. But I went on a fairly aggressive treatment, 3 treatments a week, because I was determined to go off to school in the fall.
That's great.
No one was going to stop me. So we did a rather aggressive treatment, and I responded very well to it. I did great. I definitely wouldn't have been able to get through the summer without my family, but almost more importantly, my nurses. I have a wonderful relationship with them, and continue to this day to really just, they're like my second family. And so I went off to school, and I did excellent. I made the dean's list, which was incredible for me, thinking, you have this lack of memory, and I just had to work extremely hard. And I was really comfortable at school, but when I came home from break, for Christmas break, I remember on Christmas I was crying to my mom. She asked what was wrong. I said, if I can't be happy on Christmas, when will I ever be happy? So it was after that, my family and I decided that maybe I should stay home the second semester, get more treatment, see what's, if we can figure a few things out. And I'm currently in I'm having ECT treatment again. Right now, we're doing a really long, slow taper, and I'm doing excellent right now. I finally feel great. I'm almost back to my old self, and it feels great to be smiling a lot, and I really do think I'll be happy on Christmas this year.
Caitlin, that's great. Thank you.
That's great.
Mark?
I'm Mark Meyer. I'm 42 years old. I live in Minneapolis, Minnesota with my wonderful wife of 18 years and my 3 children. I was first diagnosed with depression when I was a junior in college and had lived with the signs and symptoms for probably a number of years through high school. My oldest brother has suffered with bipolar illness for a long time as well, and so we have the genetics and the traits in our family. When I was a junior in college, I started having a lot of panic attacks, certain classes I couldn't sit through, I couldn't focus, and it's when I first started to really think about suicide. And at that time I was adequately afraid of my thoughts that I did go to the counseling center at the university. And I remember that day like it was yesterday, because I'd love to go back and do things a little bit differently. But I walked in and I remember sitting down and talking to a psychiatrist who talked with me and had me fill out a couple of inventories. And she came back and suggested that I was depressed. And I remember those words ringing through my head, because that meant if I was depressed, then I was everything that I didn't want to be, that my brother had been, that other family members had been. And I became very frightened. I got up and I walked out. And for the next 15 years, I lived with various degrees and forms of depression, from mild to when I would start to get more suicidal and struggle. I walked off a job. I was the administrator of a large healthcare clinic in Minneapolis, had a series of panic attacks and was profoundly depressed, and had it in my head that if I just quit my job and got rid of the stress, that my depression would take care of itself, and of course that wasn't the case. And so over the course of that time, like I said, with each passing year, my depression would come back and get progressively worse. I certainly had years where I was pretty flat, so not necessarily depressed, but very blah, just didn't really feel anything. And about 8 years ago, I had my first attempt at suicide. I was very stressed out. I was very depressed. I had continued to refuse medication. I had been to a physician a number of times. And I found myself in my basement with a knife and with all these thoughts of how I was going to harm myself. And thankfully, my wife, who is an amazing person, and I wouldn't be here today without her, took me to see a psychiatrist. And again, one of those points I missed, I went into the psychiatrist's office and at least sat down and listened to what he had to say and took my prescriptions and thanked him and walked out and promptly threw my prescriptions in the garbage. Again, thinking that I was weak, and if I simply tried harder, I'm a hockey player, I'm an athlete, I can get over these things. And of course, that's not how it works, unfortunately. And what happened is about a year later, I got very, very depressed and had become acutely suicidal. And it was only through the miracle and luck of my then 9-month-old crying in the middle of the night that sort of shook me from what I had intended to do to myself. And thankfully, I was then placed in the hospital. And was in the hospital for about 3 weeks. I was initially placed there against my will, which thankfully I was, again, because I'm sure if I had been given a few moments to collect my thoughts, I would have gathered my things and walked out of the hospital. It was at that time that I met my psychiatrist, and somebody who I never ever thought I would connect with or have anything in common with. And I began treatment, and I started to take medication. I started to get some sleep, hadn't slept in months. And when I got out of the hospital, I went to some outpatient therapy, went to some outpatient group therapy, made some very conscious and profound changes in the way I live my life. And because of all of those things and all the support I have, today I sit here, I coach soccer, I coach softball, I have my own business. I'm actively involved in trying to educate others about depression. And it was really because of the help of so many different people that I am able to be here today.
Thank you, Mark. Mumtaj, some of us are talking about struggling with our own issues. Others have family members. In your case, you're a mom who has had, and a wife who has had to face these issues. You want to tell us about your...
It's my daughter. I'm Mumtaj Barry Brown from New Jersey. I'm an administrative law judge. My daughter, Yasmin, who's 30, was diagnosed with depression when she was in the 10th grade. Much like Caitlin, she had an upward struggle, was very resistant to medication, but she did make it through 4 years of college, and she went on, straight on to graduate school and got her master's in epidemiology from Yale University in 2002. And 2 months later, her dad, my husband, who was also a Yale University graduate and a physician, took his own life after many years of depression. That began a spiral up and down trend for her. Yasmin has been on numerous medications. They've tweaked it, she's tried it. She has been to several psychiatrists. She's very compliant with her medication and medical treatment. She has outgrown about 6 psychologists and therapists, but she continues to struggle. It has interfered with her career, her relationships, but she is determined. And she's had 2 series of ECT, and at this point, she's at a point where we need to try again on some new medication, a new therapist, and perhaps some ECT, and she is willing to do that because we have decided as a family, we're determined, we have to break the cycle. Not only her dad, but her grandfather died from suicide. So we're at this point where it doesn't have to continue. We're strong believers, and we know that there is treatment if you keep trying, and I'm here to help my daughter and someone else's daughter if I can.
And perhaps future generations beyond that.
Absolutely.
So the goal of this program is to enhance awareness so that we can get the appropriate treatments and achieve and sustain wellness. Let's just bounce questions off now as we talk about this. For some of you, you had to face the choice. What were you thinking and feeling as you made the decision to first go into treatment? Okay.
Desperation, I think, probably is a word that would sum it up quite well. I just knew that I couldn't live life in this way with chronic anxiety, panic attacks, and depression, and my family was suffering. My children were still young at that time, and I thought that they can't just see a mother sleeping or not sleeping or afraid to leave the house, and I was already in treatment when I was feeling desperate. I entered treatment very quickly because I knew this just was not me and I couldn't manage any other way.
How about some of the others? I mean, desperation's a strong word. Any other thoughts?
I think it describes it pretty well. With my experience, I felt like I had lost who I was. I didn't know who I had become anymore. And having this, like Ruth said, being desperate to get better, to feel like myself again. It was hard.
What symptoms in those stages, in those earlier stages, or even now, have bothered you most? Bill?
I think that, as I alluded to earlier, the loss of control in it's something almost indescribable when it comes to nothing that you do or think about that you can derive any pleasure from. And then the loss of the feeling of happiness. It's really hard to explain, and it's really hard to understand, and when you're going through it, you're just overwhelmed. It's like, this can't be happening to me. I go back to Mark's comment concerning, you walked away twice, and I think that you feel like walking away because but you just don't know where to go and what to do.
But you also lose your humanness. You lose the capacity to care about other people, to love, to relate, and also to think. I think that one of the things that people forget about depression is that it's not just emotions. You can't concentrate, you can't think, you ruminate, and so your ability to negotiate the world just disappears, and so it becomes terrifying. It's absolutely terrifying.
Ruminate, you want to explain that word?
Ruminate, it's like being a mouse on a wheel. You just keep going, covering the same territory.
The same negative thoughts over and over.
Right.
It's a kind of, I wish I should have, you go back and you beat yourself up almost, and that's so unfortunate, and that's, you only say what you should have done or what you didn't do.
Right. I know for me, I had become so preoccupied with my own death and the guilt I carried with that, knowing that I was going to leave a wife and 3 kids and still not able to stop those ruminating thoughts, those suicidal thoughts, and the guilt and the pain associated with that. And it's, when you look back, I look back now, I mean, I can't even imagine that was a part of my thought process.
And you lived with it for a long time.
Yeah.
That's interesting that Mark should say that. It just triggered a thought with me. When I'm feeling very, very well, as I have really been now for some time, I can hardly but I can hardly recall completely how awful that felt. On the other hand, when I'm feeling very awful, I can hardly imagine feeling any better.
Right.
So it's that severe a feeling that it's hard to bring up the good or the bad.
Right.
That's true.
Several of you, as you were going through your introductions, made reference to the fact that you, I don't know what word I want to use, but resisted treatments. Mark, you did it for 17 years.
I refused treatment for a long time, obviously. And, if I could go back, boy, I'd like to recapture a lot of that time, because how quickly I responded to medication and therapy, it was amazing. And so definitely don't ignore it, because I almost lost my wife. I did lose a job. I mean, it really impacted my life in several ways.
Kay, did you ever resist treatment?
I resisted treatment. There was 10 years between the time I first got sick and the time I went to see a psychiatrist. Even though I was in clinical training, I resisted the idea that I needed help. I was brought up in the military, and it really kind of wasn't done. And you didn't admit defeat, you didn't admit weakness, and I didn't think that there was anybody that could help me. And if I hadn't, I've always thought it was a great advantage that I went stark ravingly insane, really manic, or I would not, probably to this day, A, I would be dead, and B, I would never have gotten treatment.
Right.
I took that extremity, and then even when I got treated, and I got very good treatment, after about 6 months, I did so well that I decided, gee, I don't need this anymore. I had side effects, and that started a whole series of on-again, off-again fights with my medication, which were, as you say, a complete loss of life. You just lose those years, and I regret that enormously.
And that question about stopping treatment when you feel well, we'll come back to, because it's important enough. Mumtaz, you lived with family members. Did they resist treatment? Your husband, for example?
Well, yes. When you're a professional and you're licensed, I know that was the catalyst, the stigma of going for treatment and then having to put it down on an application. And it was a vicious cycle, because the public and the professional boards are not yet cooperative or accepting of this, and it was such a stigma. And it carries through today in many ways. I know with my daughter, and you know, what are people going to say? And so my advocacy is, all right, you know, we got to open up, we got to come out of the closet and tell it like it is. And there are laws that are very supportive and will, you know, support your choice to get help and carry on.
Sorry, I heard Bill say he thinks we're making progress. I do too. We've got a long way to go, but in overcoming that stigma.
Yeah, I think I was really pleased and as well as surprised at the number of people that whose lives depression touched, or they knew someone that had a depression, and how supportive they were. It was very surprising to me, and I was very pleased.
When you have 1 in 5, and when they know somebody and or have family members, it's inevitable. The statistics just jump out at you. Yes. So it's so as we walked through that first story, all of you either were telling about your own issues or family issues about resistance and difficulties. What do you think, from your own personal experiences or those that you know, are the primary worries about treatment? Dr. Clayton asked me a question: what do patients worry about? What were worries about starting treatment?
I know for me it meant I had to admit there was something wrong, and that was very worrisome to me. And that when I finally came to grips that, you know what, depression, like diabetes, like heart disease, like anything, is an illness that will respond to treatment, then it became easier for me to accept. And you know, I was afraid of the sort of the stigma, but I've certainly learned to get over that.
And also the fear that the treatment might not work. As long as you don't seek treatment, you don't risk anything, and you do risk something if you seek treatment and it doesn't work, and that too is frightening, and the professional consequences.
Dr. Clayton asked me about side effects. Did you worry about those?
I had them. I don't know if you worry about them. Sure, absolutely. Who doesn't?
But I think the side effects are not anything when you compare it to feeling better and getting better. To me, that was kind of secondary. You want to be better so much that at all costs.
And so maybe we'll come back to that question again too, because it's important enough. The references that were made by several as you made your introductions were to electroconvulsive therapy. That's actually a treatment that I think has a little bit of an aura associated with it, and yet you said it made you much better.
It made me, it was the one thing that really worked, because like I said, I would get to a point, but I couldn't ever get past that. And I responded extremely well to the treatment. It took me a while, but definitely, not just mentally making me feel better, but also I would, as far as I would say, socially, and I was able to widen my support system, get to know some really wonderful people through it all, because, you know, your nurses are really what gets you through it, and I have made some wonderful friends that I know I'll have for life just through it.
We've also heard a number of references now to family aspects and to all of the issues that represents. Other family members who have had this, what do we do when family members get this? Or am I going to get this because siblings have had it? Do you want to comment about the importance of families in a more positive way?
Oh, I think family is definitely the most important thing for me. Without my mother, I don't know where I would be right now. So I like to say she's been my warrior.
She's been your warrior?
She's been my warrior.
Warrior.
Well, probably warrior
both.
too. But she's just been my advocate, just really there. Really is like, gets me going at it too. Like, come on, Caitlin, you need to push through this, be in charge of your own health, really get well. And in that aspect to make me grow up a little bit, accept responsibility for my own self. And the rest of my family's been great, but especially her.
But we'll come back to advice too, but would you have thoughts and suggestions about telling our audience about what they might do to turn to family members or to college classmates or to friends or fellow veterans?
Get them involved, educate them, make up plans when you're feeling well. To say this was really helpful, this isn't helpful. Get together with a psychiatrist, mobilize in advance while you're at the top of your game rather than in the middle of an emergency. And really reach out and educate. I mean, there's a lot known about these depressive illnesses, you know, that's the great advantage about them. There's a lot of science.
Bill, you made reference to your wife being a foundation of support.
Oh, absolutely. If I were to say to the audience, I would say about that issue is that don't be apprehensive. I think I was a little bit apprehensive when it came to, you know, initially looking for that support from her, and I shouldn't have been. I shouldn't have been. And as it turned out, when we go to doctor's appointments, and she'll sit there and take copious notes, and I'll come away and she'll mention things that were mentioned that I don't or didn't pick up, and it's just been invaluable to me.
Well, oh, I'm sorry. When you're depressed, your inclination is to isolate, and so you need, like Kay said, you need your friends and family to recognize when you're taking a downturn, and sometimes a good reminder to get up and get dressed and take a shower and participate in life is very helpful when you're not doing well.
And those need to come from people around you, and
with some gentleness and with some humor. I mean, I think that my late husband was able to say things to me that had anyone else said them when I was depressed, I would have just completely lost it. But there's that kind of communication, I think, in a good marriage that makes it much easier to deal with the horrificness of it all.
Yeah, and I would say once you teach yourself, and learn about it by going to the doctor with your loved one, and now every information is on the internet. I mean, really good information. You learn the patience that you need to be supportive, because when your loved one hurts, you hurt. When they're down, you're down, but when they're up, you're up.
So if these are illnesses, and they're treatable, and both of those statements are pretty accurate, and yet people stop treatments, and some of you did that. What advice would you give to people about stopping treatments?
Don't.
Others?
Don't do it.
Absolutely, you cannot stop your treatments. I mean, I think the science, the data, the literature is clear that the longer we can keep you well on medication, probably the longer you'll do well over the long haul. And so, I'm 7 years out from the darkest days of my life, and I take my medication every day, and I will fight tooth and nail for anybody who tries to take it from me. So,
is there that sense of I'm better, I don't need it anymore, that any of you have had?
Occasionally, I have to jump into that one. Occasionally, when I see my doctor, I don't see him as often as I did early on. I'll say to him, well, is there ever going to be a time you think I can stop taking these antidepressants? And he said, why would you want to stop when you're doing so well? And you have some times when you're not feeling quite as well. Why would you even consider that? And as soon as he looks at me and says something like that, I think, yeah, why would I? But I think there's still that little bitty voice inside that says, I'd like to know how I would do without taking this. The side effects for me are really, insignificant. And why would I? So I just quickly say, yes, that's fine, no problem. Just thought I'd check in. It happens about once every year and a half or two.
So one of the reasons, perhaps, is I want to know what I would be like without. Another one that we talked about earlier that I said I would come back to is side effects. What would you say now about advice to someone else, to our viewers, about side effects and stopping treatment?
I would say that side effects, unfortunately, might be part of the treatment, and there's certainly ways to deal with that. For me, the greatest side effect of not taking my medication is to be depressed and suicidal. So, I will gladly trade off some of the hassles and nuisance of some of the side effects to be well and to be happy.
Well, I said something earlier when we chatted at breakfast, and that was the analogy of I'm a cancer survivor, and when I was told that the chemotherapy treatment would give me hair loss and possible heart disease and possible other things, and the list went on, and I didn't hesitate for a moment. And I think that the same thing could apply to depression and medication and possible side effects. This could save your life, taking this, just as chemotherapy could save the life of a cancer patient.
It does save lives.
It saves many lives. It doesn't save some lives, but it does save many lives. And certainly antidepressants save lives. And so what of the side effects? Same way as, treatment for cancer.
Except to make the point that because you're on these medications for life, if you're taking treatments for cancer, you know that they're time limited.
Not necessarily.
So, yeah, but usually, and the extreme ones are the ones that have the most side effects tend to be limited, and so I think it is an issue, and I think doctors need to be absolutely dead on direct, be imaginative in how they deal with medications, be collaborative with patients in asking them about different trade-offs and so forth, monitor moods, see what works, what doesn't work. So that because you can't, particularly with a young person, you cannot say with a straight face that these side effects are not going to have an enormous impact on your life, because some medications that's true. Many medications it's not true. Many of the antidepressants are pretty straightforward and without side effects, but some of the other medications.
I'm hearing you say that it's worth it.
Oh, it's absolutely,
yeah.
There's no question that it's worth it, but I think that it's a question where people really have to put the time and effort in, and I mean the clinicians, not just patients, that it really has to be very much a collaborative effort.
Yeah, and I just want to say, as a family member, you have to be supportive, because with my daughter, she would get so frustrated that it's not working, I'm not getting better, and she wants so badly to be well, and then sometimes we give up, what's the use? That kind of attitude, and that's when I have to encourage her. And the doctor has to, kick in there too, and don't give up.
You just said something now, and it's what are the subtle but extremely important things that clinicians, including nurses, Caitlin, have done or should do, in your judgment, to really help the person stay the course?
Well, personally, what works for me is when I go in there, they've already read my chart. They're not flipping through it as I walk in. They know who I am, what my case is, what I'm dealing with, what I've done before and didn't work. And just really putting in that extra time. And if you find yourself with someone who isn't, to just insist on changing and keep changing and keep fighting until you find that person who works with you. And luckily for me, going into my ECT treatment, I found those people right away.
And I might suggest that it's probably very appropriate for anybody in a clinical situation to give suggestions to their clinician to say, if you respond to me this way, I actually am benefited by it.
And that's part of what I think advanced planning is all about, is to say, this is really helpful, this really doesn't help, and to have it be a very collaborative one. And also I think for any doctor or psychologist, any treating person, to extend hope, because hope is absolutely a reasonable sort of thing to do, to extend. These are treatable illnesses, and the first thing that goes when you're depressed is hope. It's the profound hopelessness that pervades every aspect of your mind, and so you really want to be in a situation where your doctor is saying, yes, I know you feel terrible.
So
yes,
let's close with some brief parting words for our viewers, for our audience. What advice, Bill, haven't heard from you for a little bit, what would you say about awareness and getting better and staying better?
Earlier it was mentioned about the internet, and it is a valuable resource, but I think that patients or people doing research on depression or other behavioral health disorders need to really closely monitor that, because I think that in my case I would go to the internet quite a bit, and there was quite a bit of information that wasn't accurate. And if you get the right sources like, University of Michigan Depression Center, WebMD, and those types of, you've got to be sure, but then to validate it with your clinician. I mean, once you don't accept it, you need to validate it with your clinician at the time that you think you have gotten valid information.
One or two more?
Remember support groups.
Yeah.
The Depression and Bipolar Support Alliance, the National Alliance for Mental Illness.
So getting information is important. It's trusted information that I'm
Yes.
hearing you say, and that
Yes.
means checking it out with your clinicians.
Well,
Other words, final words of advice,
would
just a
say,
few brief comments?
what has been my steadfast strength is prayer. I pray every day, and I often wake up and say, okay, Lord, she was your child before she was mine. And I'm from a family that believes in prayer. So as long as Yasmin is complying with the medication and therapy, the hope really doesn't die. That's there, and the encouragement gets us through the next day, and I'm thankful every day when I wake up, and I've lost a lot, but I have so much more.
So as we now do this, I know there are more things that you could all say, but we're here to enhance awareness, to literally try to provide a roadmap for people to walk through these things. And it's my belief, and it has been for some time, that we need voices to do this. We need powerful voices, and today you've been eloquent voices, and you're doing it from experience, and you're doing it from openness. And so I want to thank you personally, and also on behalf of our viewers, and on behalf of the people who support the American Foundation for Suicide Prevention. I would also encourage all of you to go out and get more voices, because frankly, that's part of how we counteract stigma. And you're doing something to make a difference today. So for the panelists, thank you, and all of you. That's our show. We hope that these discussions have furthered your understanding of the critical role depression plays in suicide. Our real goal here today is to really get this recognized, get it treated, and to prevent the tragedies. Depression's an illness. It's treatable, and one needs to go see your clinicians. So for the audience, we further hope that if you recognize depression in yourselves or in others close to you, you'll make sure that treatment is sought and that it's continued, and as you heard from our panelists, that wellness is achieved and sustained. Thank you so much for joining us, and on behalf of the American Foundation for Suicide Prevention, I'm John Greden. Thank you.